Testicular mesothelioma is a rare and aggressive form of cancer that develops in the protective sacs surrounding one or both testicles known as the tunica vaginalis. While surgery followed by chemotherapy is the standard treatment approach for testicular mesothelioma, some patients may be interested in considering alternative or complementary therapies in addition to conventional care. There are a few alternative treatments that some patients have looked to for testicular mesothelioma, though more research is still needed on their effectiveness. Diet and lifestyle changes can be considered as an adjunct to conventional cancer treatment. Eating a whole foods, plant-based diet rich in antioxidants, vitamins, and minerals from fruits and vegetables may help support the body's natural healing mechanisms. Maintaining a healthy weight and getting regular physical activity also helps boost overall health and wellness when going through cancer treatment. Sleep, managing stress, and yoga or meditation are other lifestyle factors that may aid in recovery. Some early research has linked the Mediterranean diet to better outcomes in mesothelioma patients. Adopting anti-inflammatory dietary patterns and lifestyle choices is a low-risk approach some patients choose to supplement their medical treatment plan. The use of herbal medicines and supplements is another alternative some mesothelioma patients consider exploring. Turmeric contains the active compound curcumin, which has been studied for its potential anti-cancer properties including on mesothelioma cells. Cannabidiol or CBD oil, derived from hemp plants, is sometimes used for symptoms like pain, although its impact directly on cancer cells needs more research. Canaderma lucidum or reishi mushroom has a long history of use in traditional Chinese medicine and early lab studies show it may have anti-tumor effects. However, the evidence for any herbal therapy's impact on testicular mesothelioma specifically is very limited and patients should use caution and consult their medical oncologist before starting any supplements during cancer treatment due to risk of interactions. Acupuncture is a component of traditional Chinese medicine that is used by some as a complementary approach for cancer supportive care. Acupuncture aims to unblock qi or life force energy along meridian pathways in the body. Small sterile needles are inserted at specific points. Some research in non-small cell lung cancer has shown acupuncture can help improve quality of life and reduce symptoms like pain, anxiety, and nausea from chemotherapy. For testicular mesothelioma, acupuncture would primarily be used to relieve side effects rather than directly treating the cancer itself, though early studies in mice suggested it may help slow tumor growth in mesothelioma. As with herbal medicines, patients should only consider acupuncture as an add-on to conventional therapy after discussing with their medical team. Hyperthermic intraperitoneal chemotherapy, also called HIPEC, is a specialized surgical treatment being investigated as a potential strategy to improve outcomes in peritoneal-based cancers like testicular mesothelioma that has spread throughout the abdominal cavity lining. In a HIPEC procedure, very hot chemotherapeutic drugs are directly infused into the peritoneal space while the abdominal area is heated during the surgery itself. The heat is thought to help the high-dose chemo drugs penetrate deeper into any remaining microscopic tumor cells left behind. Some early clinical studies and case reports show promising results using HIPEC after testicular cancer surgery, with improved survival seen compared to standard chemotherapy alone. However, more research with larger numbers of patients is still needed to determine how effective HIPEC may be for testicular mesothelioma specifically. It is considered an investigational alternative treatment approach. Photodynamic therapy is another emerging treatment modality being explored for certain cancers, including potentially for mesothelioma. In PDT, a light-activated drug called a photosensitizer is administered that accumulates preferentially in cancer cells. A laser or other specific wavelength of light is then shown on the tumor, which activates the photosensitizer and produces reactive oxygen species that irreparably damage the cancer cell DNA or membranes. For mesothelioma, PDT could potentially be used as a complement to surgery to target any remaining microscopic disease. Early laboratory and animal research shows promise against mesothelioma tumor growth inhibition with PDT. However, more clinical studies are still needed before PDT could be routinely recommended or utilized in standard practice for testicular mesothelioma patients. While surgery and chemotherapy remain the standard treatments for testicular mesothelioma currently based on research evidence, some patients explore engaging complementary lifestyle and alternative medicine modalities such as dietary changes, acupuncture, herbal medicines, and investigational procedures like HIPAC or PDT to supplement their conventional care. However, the evidence for impact on testicular mesothelioma directly is still limited for most alternatives besides supportive effects alone. Patients should discuss thoroughly with their medical oncologist before adding any other therapies to their plan of care to prevent dangerous interactions or diagnostic confusion regarding treatment outcomes or prognosis. More research is still warranted on alternative strategies for this rare cancer. Maintaining both hope and skeptical inquiry is important when weighing treatment options for testicular mesothelioma.